Elbowoods Memorial Health Center was opened in October of 2011. Elbowoods is located in Newtown, North Dakota, which resides on the Fort Berthold Indian Reservation. Elbowoods serves the MHA Nation, which is the Mandan, Hidatsa, and Arikara Nation. We have a beautiful culture. We have 3 tribes on our reservation, and there is a richness that you experience when you come here. I'm actually a member of the Arikara tribe. When I was growing up, we had one little clinic. Our reservation had one doctor to provide the health care for all our tribal members. We didn't have the services available, and now we do. I think it's great to be able to have our own healthcare system. Elbowoods is very important to our communities. We provide a service to our people that would otherwise not be available, and our people would have to travel long distances for their care.
If you had to get up and go to an appointment 2 hours away and drive off the reservation, some of our people, quite frankly, just said, no, I won't go. And if they don't go, then preventative medicine goes out the door. Historically, we've got some real serious issues with diabetes. We are suffering at rates of cancer higher than the average population as well. Now that we have a facility, now that we have a support system, we can treat our people, get at problems sooner, so prevention comes into play, and we can also do referrals at an earlier stage as well.
We are the primary clinic of 5 clinics in total that provide healthcare services to our entire tribal membership.
So in a typical week, I travel about 800 miles.
How have you been? Good.
I know that these patients greatly appreciate it because many of them don't have mode of transportation, so for some of them, this is their only form of healthcare.
Looks really good.
Patients don't come in just for one thing. They will come in with a list of everything. There is an interprofessional way that we work, and it's not just the physicians and the nurse practitioners. It's also our nurses, even our lab techs. They're right there working with us. So it's really important because no one's here practicing by themselves. And so our providers really work to treat the whole patient. Family practitioners, internal medicine. We do some prenatal care with our family nurse practitioners. We have our dentist on staff. In our mental health department, we are seeing folks that have post-traumatic stress disorder, major depression, anxiety. Native Americans have the highest rate of suicide, often not talked about, often not recognized. I'm the only psychiatrist that is working with the clinic at the time. There's a lot of need, and sometimes we just wish we had more people here.
Working on a reservation with the Native American people, they're very spiritual people, and they do have different beliefs and they have different beautiful traditions. You need to be mindful of those things when you're treating them, because if you're going to show them respect, they're going to show you that same respect, and not only that, they're going to trust you.
Our clinic and clinicians are very well aware of our cultural aspect in regards to healing and wellness.
We've been able to introduce our customary and traditional ways of medicine into this modern context of this facility. That is the philosophy, that is the goal, have culturally competent care, and what that means. We have to do things in ways that our people are more receptive to wanting to get that health care.
We do have challenges here, and some of them are because we're so rural, we may not have all the expertise, but that's what we want to bring here, is the expertise, because I believe our people deserve that. Our people deserve the best in healthcare. Our clinics are depending on the National Health Service Corps to assist us in getting us certified, qualified healthcare practitioners to provide a service to our people.
National Health Service Corps has offered loan repayment for providers who are willing to serve in underserved communities. Not only are you receiving the fulfillment and benefit of helping people who are underserved, but you are getting financial support as well, and that's awesome.
This is a very wonderful program. I didn't have to worry about paying my student loan, And then not just that, but coming to do the things that I enjoy. I was in private practice for quite a few years. I didn't want to base a decision on seeing a patient based upon their ability to pay their bill, basically. Here, I see everybody, and that's what I wanted to do.
My last year in college, I applied for the scholarship program. When I finished, I was debt-free, and then I did 4 years, 4 wonderful years. I went in thinking 4 years and I'd go back to my normal life. Well, this is my normal life now.
We are sort of disadvantaged, very rural, high-need area, but once they get here, they become sort of part of our family and part of our community, and they choose to stay, you know.
For me, there is this great excitement about being able to impact a community.
We want to welcome all of our big veterans here tonight, Indian and non-Indian, male and female. Here we go.
Every community is very proud of their powwow, and they want you to come and enjoy and participate. I like to see the whole community come together. So you'll see, you know, little kids dancing, you'll see elders dancing, you'll see family members supporting them.
This is how everybody gets together and celebrates. I see a lot of people greeting each other, a lot of people that are happy to be there, a lot of excitement, a lot of history. It's a very beautiful thing to see. A very wonderful people, a very giving people, and very thankful.
I do love my career. Every single day I feel like I'm able to make a difference for people and touch people's lives, and they touch mine too.
If you're looking for a job that you will love, it's really investing in people's lives and investing in a community. And you need to look at National Health Service Corps.